answering prioritizing questions that ask what the nurse should do first, always check the case scenario carefully to see that if the nurse in the question has enough information to proceed. Look at the introductory statement to see what information you've been given about the client situation, what the nurse is doing, is preparing to do, or has already done. Be sure you have identified the issue of the question. Then, look for nursing behaviors in the options that address the issue. However, if the nurse does not have enough information to initiate an action, or if several choices appear plausible because they are relating to the issue of the question, then you must look at an option that includes an assessment behavior. This is because we know that the nursing process states that the nurse must always assess first before planning or implementing any nursing action. Assessment always comes first because the nurse must obtain all the necessary pertinent data and information before initiating any action. Let's take a look at priority question that would require us to apply the nursing process, to eliminate distractors and choose the correct response. First, let's separate the case scenario from the stem of the question. The case scenario tells us that the client's husband summons the nurse saying, "Come quickly, my wife fell and hit her head." The stem of the question asks, responding to the client's room, the nurse knows that the first priority will be. In identifying the critical elements, we find the key words to be priority. The client is the client who has fallen. The issue is the client fell. The type of stem is a priority response stem. Look at and eliminate distractors. Now this is truly a priority question where at first glance not only do all the answers look right, but they are all actions that the nurse will need to take. We will assign question marks to all of them since we know that every one must be done. We need to decide which action is of first priority. The NCLEX exam has many questions like this. Option number 1, call the client's physician. Certainly the physician will need to be notified, especially if the client has been injured. But do you have all the information you need before taking this action? Remember, before you intervene, nursing process says you must first assess. Is there an assessment action listed? Option 2, assist the client back to bed. Certainly the client will need to be assisted back to bed at some point, but do you have all the information you need before taking this action? Remember, before you intervene, nursing process says you must first assess. Is there an assessment action listed? Let's go ahead and skip ahead to choice 4 for a moment. Ask the husband what happened. This does appear to be an assessment action, and the nurse will certainly want this information at some point. But remember to always choose an action that focuses on the client. Let's look at option 3. Check the client for injuries. This is the only choice that is an assessment action that focuses on the client. With only the information in the case scenario, all you know is that the client fell. The client may be unconscious or even asystolic. In this nursing process question, we now have only one answer that is an assessment action that focuses on the client. So now we go with what we know and select choice 3 as the correct option. Are you ready to try one on your own? Okay, here is a sample priority question. In this drill, I would like you to practice using the nursing process to set priorities and eliminate options. How did you do? First, let's begin by separating the case scenario from the stem of the question. The case scenario tells us that after passing 8 a.m. medications for the team, the nurse suddenly realizes that a medication ordered for one client, Digoxin, was inadvertently administered to the client's roommate. The stem of the question asks, the nurse's priority action is to. Let's identify the critical elements. The key words are priority. The client is the client's roommate who got the Digoxin in error. The issue is the client's medication was administered to the wrong client. The type of stem is a priority response stem. Now we can start to look at and eliminate distractors. Option 1. Check the client's vital signs. We will assign a plus sign to this choice because it is an assessment action that focuses on the client. With only the information in the case scenario, all you know is that the client got the wrong medication. The client may be at increased risk of side effects from the digoxin, such as bradycardia. Let's look at other options to make sure that there is not a more important assessment action. Option 2. Notify the client's primary care provider. We will assign a question mark to this choice because certainly the physician will need to be notified, especially if the client has suffered side effects from the medication. But do you have all the information you need before taking this action? Remember, before you intervene, nursing process says that you must first assess. Option 3. Fill out a variance form according to institutional policy. We will assign a minus sign to this choice. Certainly a variance, occurrence, or incident form will need to be filled out according to institutional policy at some point, but remember to always choose an action that focuses on the client rather than hospital policy. Option 4. Prepare to administer Digibind, which is the antidote for dig toxicity. We will assign a minus sign to this choice. Digibind, being the antidote for digoxin, may need to be administered if the client experiences or is at increased risk for experiencing side effects from the administration of the digoxin. However, before taking this action, the nurse must first assess the client to determine what the client's current status is. In this nursing process question, we now have 2 probably wrong answers, choices 3 and 4, 1 possibly right answer in choice 2, and 1 probably right answer with choice 1. So now we should go with what we know and select choice 1 as the correct response. Let's look at another nursing principle we can apply to priority questions.